is a special podcast created for the American Anthropological Association's Raising Our Voices event. My name is Lindsay O'Frias. I am an anthropology PhD candidate at Princeton University, currently writing my dissertation on health and environmental justice in the oil frontier of the Ecuadorian Amazon. I am your host today.
And I am Vinicius Furuye, your co-host. I am a postdoctoral fellow at the Harvard University Center for the Environment, investigating how riverside communities in the Brazilian Amazon approach their environmental and economic challenges. Today, we bring you 3 interviews done remotely with friends in Ecuador, Brazil, and the United States that address initiatives to decolonize healthcare during the COVID-19 pandemic. Thank you for joining us.
As non-Indigenous anthropologists, Vinny and I believe this is a critical moment to grow our understanding of their intersections between disease, colonialism, racism, and capitalism. We spoke with Desiree Kane, a Miwok journalist, Leo Cerda, a Quechua climate activist, and Erica Pellegrino, a non-Indigenous doctor in Altamira and professor at the Universidade do Pará, Brazil, about several grassroots initiatives which are confronting inequality head-on.
Their stories about dealing with the pandemic on the front lines speak of hardships that disproportionately affect Indigenous people, people of color, and other marginalized communities around the world today. But they also offer inspiring examples of what collaborative work can accomplish. We think this podcast will be useful for anyone who wants to learn more about community-led health initiatives, including how they are brainstorming effective coalition building among non-Indigenous and Indigenous people.
Our first guest is Leo Cerda, a Quechua climate justice advocate based in Ecuador.
I am from Serena, which is a small village in the Amazon basin up in the Ecuadorian Amazon. You know, we didn't have any access to communications and information that were in our language. You know, a lot of the people in our communities do not speak Spanish, you know, and didn't know. And while everything was being shut down, a lot of people didn't know why. And a lot of the communities in the Amazon have the same disproportional access to things. And in terms of PPE and information and medicine, that was really hard. A lot of people passed away in the communities, a lot of the chiefs, a lot of the elders. I think moving forward, we need to have culturally appropriate responses, you know, for the different groups that there are, because there were not culturally appropriate responses. During the pandemic, also the government exacerbated extractive practices in indigenous territories. You know, even though they were not giving any PPE or access to medicine, they were extracting the resources, and that represents the colonization, like the colonizing structure and the mindset of the government.
On April 7th, 2 major pipelines nearby rivers in Ecuador collapsed, releasing thousands to tens of thousands of barrels of crude into rushing rapids. Mitch Anderson from the organization Amazon Frontlines reached out to the Sierra Club for support. Try to imagine, his report on their website reads, a deadly airborne virus is sweeping across your country. The government declares a national emergency and tells you to shelter in place. Your home is the forest, and your isolation is your only protection. There are no supermarkets, clinics, or hospitals. For many communities, the nearest ventilator is several days' journey by canoe and foot. Then, at the worst possible moment, a massive man-made disaster devastates your home and eliminates your only source of food and water. Anthropologists Eduardo Cohn and Manuela Peak, soon after in Al Jazeera, raised a series of questions about the situation. What should you do in the case of a fire during a tornado? Leave the building or stay inside? They pointed out that, quote, public safety drills generally prepare people for one disaster, not for 2 simultaneous ones that require opposing responses. But this is what Ecuador's indigenous people are facing today.
There are a few things that as a communities, as indigenous people, we saw that we need to keep our resources under the ground. We need to take care of like our food and our food sovereignty, and also rebuild like our minds, in terms of like building resilient communities, because this pandemic just exacerbated the things that were already happening in our communities and in our villages, in our towns, and now we're thinking about, okay, how can we build a resilient community with the experience of we just went through. When we talk about resilience, we should be talking about like how can we balance our community life with the protection of our natural resources with what is happening outside. There was nothing that money could buy while we were like in lockdown. If you had food or if you didn't have food, that was the thing. The community also went back to like medicinal plants, traditions, and we were able to contain the spread of the pandemic. We're able to stay at their homes, They have their, like, in terms of food sovereignty, we have the process of the chakra, The chakra is a small plot and where the family grows the daily produce, like their fruits, their veggies, their produce in general. So it was very nice to see that the indigenous families were able to feed themselves, with what was being produced locally. A lot of the indigenous people that were in the cities came back to the communities and started like rethinking about what is the future represent.
For as long as I've known Leo, which has been for many years, he has been on the forefront of not just envisioning a different future, but actually building it. His organization, HAKU, promotes sustainable development projects with several indigenous communities in the Ecuadorian Amazon.
The government, with transnational oil companies, they were given this notion of development to the community, saying like, if we extract oil, if we extract natural resources, you will have a better life. You'll have access to education and health. And that has not been the case, especially in Ecuador where I live. The communities that allowed oil companies to extract their resources were contaminated, are sick, and their territories are still sick. Since the late 1960s, we've seen in Ecuador what has happened with oil, and we needed a way to say, okay, there are other ways of alternative economic development, and which we can generate a source of income in the communities. That's why we started the project. We work with more than 200 women from across the Ecuadorian Amazon, bringing them income, where they can make their handcrafts in their households, in their spare time, and then share their knowledge with their kids, with their household, with the house, while having an income in their community. Our bottom line was not gaining profit, Our bottom line is securing jobs for the women while telling a story to the world. That's our bottom line, like educating people where this peace comes from. Where this peace comes from is from a woman who is an activist, who's defending her territory against extractivist policies and companies, and who's fighting for the future of her community and for the future of the planet. But there are many, many projects like this. We should support our local communities, buy locally, support projects that come with that story, who are trying to make a difference in the planet. Like Haku and the jewelry project is just one of the things that we do as a whole. Like Haku is working with the Black Indigenous Liberation Movement, and then we work at bringing people to the international spaces so we can have a voice as Indigenous people around the climate agenda. We can have a new world that we can envision, in which Indigenous people are healthy and have access and have territories. Because a lot of Indigenous people do not have territories anymore. The government has sold out their lands to extractivist corporations. So That's why we need more projects and more people thinking about how can we support each other collaboratively across the Amazon and across the world.
Listeners can follow Lea's work through the website haku.org, hakhu.org, and blackindigenousliberation.com. Now we will pivot to Altamira in the Brazilian Amazon, where Erika Pellegrino lives and works as a medical doctor and professor at the local university.
Hi, Erika. Thank you for joining us today. You've explained to me previously that the Brazilian public health system was conceived for urban areas and that the people who live in remote regions of the Amazon cannot access the healthcare system. You also told me that the medical school where you currently teach in Altamira has partnered with two NGOs, Instituto Socioambiental and Health in Harmony, to provide healthcare to riverside communities in the Xingu Basin. The partnership comes from the understanding that families with access to healthcare can better defend their territory against land grabbers and loggers. Could you tell us a little about what you learned in this partnership, especially since the emergence of the COVID-19 pandemic?
I learned a lot, but it was, I think, the more difficult thing for me in dealing with the Western medicine in the hospitals was the way they dealt with isolation and death, people that were near death and people that died, and all the protocols that would stop people that from the family to be together with their elders and to be near them. And it was really heartbreaking to me being at a hospital with some elder people that were getting worse, and sometimes they thought that their family abandoned them because they were not visited, and their family actually was going there every day, wanting to know more, wanting to get inside and see them and at least say goodbye at some point. So I think this is, for me, as a mental health professional, it's the more difficult experience in the Western medicine. And we also, like all the funerals, everything was interrupted. So people would go straight to being buried in a closed coffin. And it was really hard for everyone involved. And this is something that we had two, unfortunately, we had two deaths from indigenous people. And one of them was not a COVID confirmed case, but it was a suspect case. It was in the beginning of the pandemic, so everybody was very concerned. And we had a very important action from the public prosecutors here that she's very involved and very compromised with the indigenous cause. So they got the health professionals and anthropologists, everybody to go together with the body to get buried at their land, their traditional land. And I think this was amazing. It was very important for everyone. This was one of the most difficult parts of discussing the protocols with the indigenous health professionals, because they knew that it was a risk. They didn't want to make it seem that they could guarantee safety for anyone in the community. And so it's a very difficult decision. You have to, know that everybody could be at risk if they do the traditional rites for the body.
So, given your own focus on mental health as a psychiatrist, what are your thoughts about keeping people safe while ensuring their own cultural views are respected? How exactly did healthcare professionals and community members find a compromise to carry funerary rituals in a safe manner?
What we did in this interdisciplinary group was to discuss that, people need to have information, and with that information, they have to have the risks lowered by the health professionals. We can't guarantee, but we can provide individual protection equipments for people to even treat the body, for their indigenous families to treat the body and everything, and to assist the process to teach them how to use the equipments properly and make them understand the risks and how it's spreaded and how they could get this like with less people. So for me, I think this is one of the most different from two way of seeing the world and living and dying, from the Western medicine, Western culture, and the traditional medicine and culture. And a lot of the riverine people that got sick, that got COVID, they didn't come to have assistance in the city because they were very afraid of getting isolated in a hospital and being buried in the city and not in their territory. So I think this is something that we didn't learn with COVID situation yet, but we have to understand how we deal with dead and dying as a way of detaching soul and body, and so it doesn't matter anymore. So it's like it's just a dead body, it's just a pile of carbon atoms, and we have to deal with it as an inanimate object, and it's not like that. So I think this is a lesson that I got.
Thank you for sharing that with us. So we have witnessed several months of racial and ethnic reckoning both in the US and Brazil, with an increase in voices clamoring for healthcare equity and the decolonization of healthcare. Could you offer us some insight on what decolonizing healthcare might look like in your local reality?
Yeah, I think it's a very important question. And it's interesting because I just got back from a 16-day trip for the communities, the riverine communities. And it was one request from the communities because they've been, they were trying to stay safe in their communities, so they got a while not getting into city and not seek for medical assistance if they needed, and also for dental health, odontological health. So we went with all the protocols to the communities. And what we understood when we got there, a lot of people, even though we sent them the nurses and we did telemedicine and everything, they didn't look for assistance if they think that they had COVID. There were a few cases in which they look for assistance, and one of the cases was severe case, and we advised them to get removed. And the woman that was sick, she didn't want to. She said that if she was to die, she preferred to die in the territory. And a lot of other people got COVID after that. Some of them because they get to the city because of the government gave some emergency money for people deal with COVID. And there was fake news in the communities that if they didn't get here until July or August, they would lose the money. So some people got to the city and got the virus back to the communities after that. And also there are other pressures on the territory, and like illegal logging and mining. And so people, we were talking to them by radio and everything, but they didn't tell us that they had COVID symptoms. They were very afraid of being diagnosed as COVID. And when we got there, everybody started to tell the symptoms, and we tested a lot of people. We got more than 70% of the tests were positive. And people, they relied mostly in the traditional medicine, the medicine from the forest that they already know. A lot of herbal teas, a lot of trees that they use for making medicine. And they didn't want to take medicine from our medical, from the pharmacy. And they, for one hand, they said like things like before they got sick, they said that they didn't have health access, that everything they could rely was on the nurses and the medicine that we send them. They use a lot of, in the day-by-day situations, they use a lot of antibiotics and a lot of anti-inflammatories from the health centers that's given by the government. And now with COVID, they used mostly their traditional medicine. And a lot of people tell us that when we got there, that they now feel that they are healthier, and they think that that's because they have a healthier way of life, a healthier air and environment and food. They didn't get sick as bad as people in town, so nobody died of COVID in those communities, even though a lot of people got sick. So they were having an opposite speech, that they were healthier, actually. They have their health, and their traditional knowledge is very good for a health problem that Western medicine didn't have an adequate response to. So I think this situation, it gives me an example of how maybe not having access to the way in which we do medicine here, which is a very colonizing practice, was actually better for those communities in a sense, because they were so far away, they didn't have access, and they also don't have access to other, like to the supermarkets and to some programs that give them food. So they are used having their traditional food. It's not like we have some indigenous groups in Brazil that have higher rates of COVID death than other people. So we don't understand. Health professionals, actually, they are trained to diagnose and to treat diseases in this logic that's not based on how people deal, the names that people traditionally give to those kind of diseases. So it was very interesting that we did a training about antibiotics with the nurses from the communities, and they've been living in those communities for a while. And so when we ask them how to treat like a common flu, like in a child, so some of them like, you can have a bath with some kind of herb, we can use this kind of tea, or if you have like an infection in the skin, what would you do to treat that? You can use this plant and put it in the top, and you can also pray. There's a specific pray that you do to getting that better. So I think, and also for some indigenous group here, they were very concerned of the government protocols, because they heard about the government in Bolsonaro and everything he says like against indigenous people. So when they had like the hydroxychloroquine pills at the first phase of the pandemic, it was a thing here in Brazil as well, and they said, no, we won't take those pills. It's from the president to kill indigenous people, so we won't take that. So it was very interesting hearing that from indigenous group that refused to have a medicine that the health professionals gave to them. So I think COVID may have this effect here for some people, and I hope that we as health professionals can understand that and help them to make this process stronger, to get their traditional knowledge in medicine more valued, and understand that a lot of health issues can be and is better addressed in traditional ways, as name of diseases and way of treating them, than we do in the Western medicine.
That is very inspiring. Thank you, Erika, for joining us today. That was Erika Pellegrino from the Medical School of the Federal University of Pará, Altamira campus.
Our last interviewee for the special podcast is Desiree Kane, a Miwok journalist who I met in 2016 at Standing Rock with a group of delegates from the Ecuadorian Amazon. Desiree has been behind numerous projects documenting and organizing for a variety of causes, including Indigenous rights. For this podcast, we focused on opportunities to decolonize health in the United States.
With Indigenous people, our land is the healthcare system that we have had over a millennia, or it is one of the ways that we know how to survive and treat our ailments over time. So to decolonize health to me means land access. It means access to elders and educational programs. It means access to people who have traditional life ways that they're still living, because at the end of the day, we do have a healthcare system instituted on this continent that doesn't serve Native people so well. It has been inherently very violent with forced sterilization, all manner of things that have not been really kind to Native people. So there's a hesitancy to participate with that healthcare program. And when it's one of the only ones available in rural communities, the other one that is available is the traditional healthcare system that has been time tested over thousands of years. So to decolonize health really means to make space and make a new day for old ways. A lot of the community health initiatives that have emerged in the past few months are rooted in these types of practices. So you see mutual aid organizers working for their nation where all they're doing is making food for COVID families. All they're doing is making fire ciders and things like that that can help treat symptoms of COVID. Now the Western or American medicine system would say naturopathic medicines are not proven, they don't work. But when you're looking at an elder who can't breathe and you see how fire cider, which is it's a cider made out of garlic, cayenne, like 15 other things, and suddenly they can breathe again. Suddenly their airways are open and it lessens the suffering even minutely. That's a win. So to decolonize healthcare means more mutual aid. It means more community listening to folks who are impacted, who are living on the reservation or who are, experiencing poverty in their urban native. Listening to those folks about what works, what isn't working, and why. Western medicine really wants to believe that Indigenous healthcare practices are fake, they're woo-woo, they're not helpful, they're unproven. But when you have a community of people that have lived here for thousands of years telling you, hey, bear fat helps me with my digestion, and because I'm congested, it's messing up my stomach, so this bear fat is helping my stomach. I have a hard time believing that those things are not helpful healthcare options. Now, it's not the cure to COVID. No one has the cure to COVID. But it does mean if we are able to decolonize our healthcare systems, that perhaps we can lessen suffering. And that's something that is very much needed by Indigenous communities the continent over.
As a journalist, what can you tell us about underreported issues related to COVID?
I know out in Pine Ridge, there's one entire neighborhood that is quarantined because everyone within it is sick. And this is an underreported issue where entire Native communities are falling sick to COVID. People are also experiencing, one of my relatives works in tribal housing out in my territory in California. And the housing crisis that has come from COVID has been enormous. And it's fallen upon people who were already paycheck to paycheck, who already had 3, 4, 5 people to a room in a home. Because with Native people, when we experience a housing crisis, it does mean houselessness, but it also means overcrowding for more people than houselessness. So one of the underreported issues about COVID is this tandem housing crisis because no one was able to go to work. And if you were on unemployment at the time, unemployment stipulations were that you had to go be applying for jobs, 3 jobs a week in order to get your unemployment. So that put people's medical conditions in jeopardy. It put their housing in jeopardy. Folks are having to make very real life decisions right now, as I say this, between their child's, medication for a medical issue and housing their child, between feeding themselves and their family or housing. And when you get down to those basic needs, those are really difficult questions. Folks are choosing to just fight with their landlords instead of not feed their kids. But there's going to become a moment where the landlords are going to want their peace. Been living on their property, albeit it's on stolen land, but they're going to want their pay. So luckily, many states, which this impacts the urban native population, but not the rural who are living on tribal lands. We've had a number of states pass eviction moratoriums so that the landlords can't kick anybody out using the court system. But what they're doing, at least in Colorado, in egregious terms, is they're using moonlighting police officers to act as mercenaries and forcibly evict people in the night. And that's something that isn't making the news, probably won't make the news, because it just on the surface reads like, oh, it's an argument over money, but ultimately it's displacement of Indigenous people who have been disproportionately affected by COVID. At the same time, the Trump administration is attacking tribal sovereignty. Indian Health Service is, prior to COVID, drastically underfunded. I mean, just wildly underfunded. So when you have a health crisis in an underfunded system, people are slipping through the cracks. I know that people say, oh, well, just stay only with Indian Health Service, or just don't even deal with the health service one way or the other, trying to figure out what to do. But when it comes down to rural Native people, I live in a town of 3,800 people. I don't have the choice to go to the IHS that's 3 hours away. I have to go to the non-Native clinic when I get sick. And that has been a financial burden that arises. And so those are other taxing things that are happening with Native people that are directly blocking access to a healthcare system that is needed in tandem with the Indigenous healthcare system that is being used. So it's you want to call it an inside-outside strategy, whatever you want to call it, but there's tandem strategies of healthcare that are occurring, and one of them is majorly blocked for Native people. So we are relying, as I'm seeing, we're relying on mutual aid organizers who have taken it upon themselves, who are probably going into debt, whose kids aren't being tended to the same amount as they would because the whole family is tending to 15 families that they're suddenly cooking for, or they're gathering herbal medicines for, things like that.
And talking about housing reminds me of what you were saying to me earlier before we began the podcast about the issue of water, that even if one has access to a home, clean water is very hard to come by in certain situations.
The municipalities are still charging people for water. And when you have no income, you're forced to choose whether you want running water, whether you want to eat today, whether you have gas to get to the job that might get you money that you're working part-time, but it's still not enough so that you can buy food. Access to water has been a long-running issue for Indian country, and it's not by design by anyone in the Native community. That's certainly something that has occurred as a result of colonization and the ongoing pains of it. So when you have something that is so, like this virus, when you have a virus that is so ravaging and requires a lot of water for cleanliness and disinfecting, it makes it extremely difficult to weigh out those things. You know, I look at a pack of hand sanitizing wipes, it's $6. I know for $6 that's at least, 20 packs of ramen and maybe a sixth thing of eggs. And that's all you got. So when you're making those judgment calls, when community members are making those judgment calls and you're looking at it, these are really difficult things to struggle with pre-pandemic. Now here we are in the middle of it. And at a certain point, because especially around Denver, there's a large houseless Native relatives population. And I think those of us who are not experiencing houselessness, we have a responsibility to watch out for them. And in Colorado, at a certain point, the families that are living along the river, it gets below freezing. What are we going to say to the parents of the children who have frozen to death along the river? I'm sorry, we have 12 luxury apartments, buildings that could house the entire houseless population, but the community wanted to keep the bankers who own that wealthy, so your kid froze to death. These are the realities that Native families are having to live with. There are high-rise apartments in Denver that would house more than the entire houseless population in Colorado if they opened up these 11 or 12 buildings. And they're not. We have people living along creeks and riverways because it's free and you can be there for up to 60 days based on the, fair use laws. But I spent time in Standing Rock in a yurt in sub-zero conditions, and I barely made it, and I'm extremely able-bodied and healthy. I can't imagine what a family with no resources is going to do when they don't have a yurt, when all they have is a tent. When I said the land is our healthcare system, I meant it. When you have folks that are living along the river, if they have access to old knowledge, to how to set up a traditional living structure that has been taught to them by elders, if they're from a plains community, if they know how to set up a teepee, those are healthcare systems that save lives when we talk about people freezing or going hungry because COVID took their income. So we need those things really badly. Again, that just brings me back to the mutual aid workers, looking out for those elders, because those elders are who teach us how to survive when there's no grid, when there's no government, when there's no services, and all you have is the land. We need those folks, and we need them to stay alive. So the initiatives that have sprung up in order to be more impactful, they need resources badly. Financial resources, bags of potatoes, hand wipes, Windex, baby diapers, anything that you can think of that would be a crisis response thing that someone wanting to engage in philanthropy would send out. Those are the things that are needed now, because this is a disaster. It's a natural disaster that has hit Indian country, but it's not in one place. It's all over. So I would just encourage people to look at whose tribal territory you're on. Find the mutual aid workers. Sometimes you can just search for the name of your town or city. Denver Mutual Aid, Front Range Mutual Aid, Rapid City Mutual Aid. You'll find the people. And if you have the ability, give resources. Don't spend $12 on 2 cups of coffee when you can feed a family of 5 just for one day. So we need those types of things while those mutual aid workers are working on. There's grant mechanisms that are working, but they take time. So this is really a bridge time where the community ask is for resources, and the thanks and gratitude are extended very deeply for those types of resources in this moment.
Something I've always really appreciated, Des, how even in really difficult times, you reach out to other people and you build those networks of support. A lot of us tend to go inward, to contract, and that's why I found you to be a really incredible model. So it would be great to hear. I'm so happy to have learned about your new show that you're launching. I would love if you could share it with our listeners, because I have the sense that they will be as excited as I am to continue following your work and getting information that we don't normally or don't easily get access to.
Sure. Later this year on the Real News Network, myself, Jen Deerenwater, and Johnny J are launching a show called Decolonized News Hour, which offers news and commentary from a position that most people aren't hearing it from, which is the Native viewpoint. So we've never had any sort of show like this in Indian country, especially not on a non-Native platform. So it's a news and commentary show, all Native non-men, and just bringing another set of viewpoints that people can rely on. We'll be bringing guests on and really seeking to uplift the voices of people in the community who often are unseen and unheard because they're just out there doing the work. So we're not going to be serving you up the same cold chicken that you get all the time when you see a Native person on the news, because they only seem to put out the same 4 people. We're going to be breaking that model and really uplifting women, Two-Spirits, disabled community members, folks who we know as Native non-men don't get seen. So forget all that, and we're going to go forward and really do some groundbreaking coverage for Indian country, and for our allies.
A big thanks to Desiree, and a reminder to all of you to be on the lookout for the Decolonized News Hour launching before the new year on the Real News Network. That's our podcast. Thank you again for joining us, and a big thank you to our guests and to Sophia Pinedo-Paddock, who has supplied the music. The beautiful song you've been hearing is called Danza by Juan Luna Huamani. It comes from a project Sophia conducted of recording music from her father's homeland of lowland Peru, and we're delighted to share it here. Sending our best wishes to everyone. Stay safe, be well, and don't hesitate to reach out. We'd love to stay in touch.